And I'm Madison Adams.
And we did our poster on substance abuse.
What is substance abuse? Substance abuse is the overuse in drugs or alcohol. This usually results in dysfunction and causes a multitude of issues of the person, such as dependency and overuse interfering with daily activities and normal routine. Substance abuse disorders have complex underpinnings that affect it, such as neurological, biological, physiological, environmental, and genetic roots. Physical symptoms are usually specific to the type of substance used, but common symptoms include things that impact health, work, and relationships. A substance abuse disorder often results in physical, relational, behavioral, emotional, and financial issues. They often unable to control their desire to use as a result of addiction of using to numb pain or hard times, and their behavior often reflects this.
Here is a picture on our poster. As seen, it is a chart administered by the Global Health Survey, and it portrays the prevalence of the most used substances in 2014 in America. As you can see, the most used substance is alcohol with a 90.8% prevalence. The second most used is tobacco with 56.7% prevalence, and cannabis is following that with 48.5% prevalence. Interestingly, caffeine takes the fourth spot with only a 45.9% prevalence. The least prevalent, according to this chart, are poppers at 3.8%. For those who don't know, poppers are a common term for a psychoactive inhalant.
We chose 3 assessments that would be useful to administer for a client that has been diagnosed with a substance abuse disorder, as shown through this picture right here. The pain patient profile evaluates the patient's emotional stress associated with pain that they are feeling. This assessment has a self-report format which includes a multiple choice questionnaire. It includes different clinical scales that indicate depression, anxiety, and somatosensation. Many clients seek out substances to help with emotional and physical pain. They also often experience pain in going through the detox process and also experience withdrawal symptoms. Depression and anxiety are often comorbidities of substance abuse disorders. The second one we chose is the Occupational Performance History Review. This evaluates occupational identity and competence, life history, and personal impact of trauma on the client's life. The format of this assessment includes an interview, self-rating scale, and life history narrative. The assessment is based on the principles of MOHO. The self-rated categories, such as occupational roles, daily routines, occupational behavior settings, activity choices, and critical life events, evaluate each of the following. Individuals who suffer from drug abuse often neglect other roles in their lives, such as family relationships, daily occupations, and employment. Their substance abuse history and detox process is often traumatic and impacts their daily choices, ADLs, and perceived competence. Life history is important to gain knowledge of as well for the OT when planning treatment. The General Self-Efficacy Scale evaluates perceived self-efficacy, ability to cope with stressful life events, and daily issues. The format of this assessment includes a self-administered rating scale. It focuses on coping skills and how they specifically cope with chronic pain. Clients often use substances to try and cope with stresses in their lives. Coping skills are important for a substance abuse client to possess in order to deal with feelings of wanting to use again and for life after remission. Self-efficacy is often lower due to the detox process and past using behavior. The practice settings you would most likely see a substance abuse client would be in the rehab treatment center, psychiatric unit, or outpatient.
Possible occupational therapy treatments with clients struggling with substance abuse can be very vast. 4 have been highlighted on our board here. 1 is cognitive behavioral therapy. This teaches individuals to find connections between their thoughts, actions, and feelings. The goal is to distribute negative thoughts, distorted thinking, and insecurities that lead to substance abuse. When a client understands why they feel and act a certain way, and how these feelings and actions lead to substance abuse, it puts them at a better chance towards recovering from their addiction. Clients can learn new positive ways to replace their drug and alcohol use. One of the challenges that people face is to avoid relapsing. Leisure skills exploration is another treatment that occupational therapists use to find enjoyable activities and hobbies that the client likes. The OT can explore old leisure activities or even help the client find new ones by engaging the client in these activities. Leisure skills are especially important for substance abuse clients to have because their past leisure activities only consisted of abusing their substance. The client needs to fill their time so that they are not using a substance and enjoying other hobbies. A third OT treatment could be role and routine formation. This is a type of OT treatment that is used to help a client understand new roles and establish routines. This can be done through examining old hobbies and engaging in new roles that they used to enjoy, or by exploring an entire new realm of activities and hobbies. The client is often left with the feeling of, what now? Because they often left behind their old roles, routines, and activities when they were using. The client needs to replace the using behavior with these new activities and establish their new roles in their life so that they do not go back to their old ways. Lastly, OTs can work with the client on occupational interventions in order to improve ADLs or IADLs. Basic activities and steps of going through one's day is going to look completely different compared to when they were using, now that they are in remission. Clients often put daily occupations on the back burner while they are using, and these skills are often lost or forgotten. Basic ADLs such as bathing or other similar hygiene and grooming activities often need to be worked on with these clients, as well as other IADLs such as money management and child rearing.
We chose 2 group treatments to treat drug and alcohol abuse. The first one is social skills group. Social skills help to develop clients prepare on social situations where drug and alcohol are present. Many drug addicts and alcoholics have a problem with others in social situations. The lack of social skills calls for a social group. It consists of interacting with friends, family members, and coworkers. Clients can learn how to listen as well as talking and even understanding unspoken cues such as body language. Social settings where drugs and alcohol are present can teach clients better ways to deal with situations without relapsing. The other one that we chose was stress management group. One of the challenges of addiction recovery is finding new ways to cope when life is stressful. That is why we chose stress management to help the client build coping strategies to deal with stress and triggering situations. It helps the client come face to face with the consequences of their previous actions and deal with their feelings rather than numbing them. Substance abuse patients often deal with anxiety relating to relapse. Coping strategies can be taught on how to deal with temptations that you need to stay sober in challenging situations.
We also left a section on our poster board that will be used for some reflection. There is a series of 3 cats in different pictures, one eating catnip, one taking pills, and another one passed out drunk at a vineyard. I wanted to use this part of our poster for the reflection of how you think that an OT can help these cats.
Coping strategies can be taught on how to deal with temptations that you need to stay sober in challenging situations. Okay. Because there needed to be a period. That makes sense. Okay, cool.
This is a picture of our reference list, including our 2 ABP articles. The first article is titled, Why Addiction Has a Chronic Relapsing Course by S.A. Gutman. Our second article is titled, Substance Use Disorders and Referral to Treatment in Substantiated Cases of Child Maltreatment by S. Steenrod and R. Merritt.